According to the American Association of Clinical Endocrinologists, more than 12% of Americans will develop a thyroid disease during their lifetime, and up to 50% of those people will be unaware they have a thyroid condition. January is designated Thyroid Awareness Month. The specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain that the very small butterfly-shaped thyroid gland in your neck produces hormones that influence every cell, tissue, and organ in your body.
The thyroid is an endocrine gland that controls the metabolism among other things, and it is sort of the generator of the body's rate of metabolism. There's 3 hormones. The TSH, which is sent by the brain telling the thyroid how hard it should work. And then there's an active form of the thyroid hormone, and then there's a storage form of the thyroid hormone. And sometimes the storage form gets built up inside of the place where it's formed and makes a nodule. Used to have to wait till the person was choking or having something wrong with the metabolism before they could even be identified. Now you can find them before they start giving you trouble. I see them in just about everybody, from 20-year-olds to 90-year-olds. They can have thyroid nodules or be hyperthyroid, or have other kind of thyroid problems. Usually an endocrinologist will tell them when they have thyroid problems. Now, what I usually see are thyroid nodules, or something you can palpate, something you can touch, something you can see on an x-ray, things like that. That's more of a surgical thyroid problem. Endocrinologists refer them, the family doctors refer, and cancer doctors. You get a lot of referrals from cancer doctors when they see something on the PET scan that they can't explain. There's several different kinds of thyroid cancer. The most common is something called papillary carcinoma of the thyroid, and that's usually picked up as a nodule, or the patient can feel it as a firm area on their neck. And that's treated with surgery primarily. They can grow quite large and hide up underneath the collarbone and back towards the spine. They can be asymptomatic other than a little bit of a problem swallowing. Of course, after you take it out, it's much better, and they said, oh boy, I didn't know I was having that much problem.
For more information on this story, as well as links to the specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Thyroid Health story link on our homepage at yourhometownhealth.com.